Well, every morning you'll hear about the number of new cases of COVID-19 that's announced overnight by the Health Ministry. The body which is doing more testing than any other is the National Heath Laboratory Services. Professor Kholeka Mlisana is in charge of academic affairs, research and quality assurance at the NHLS. Professor Mlisana, good afternoon to you. Firstly, the number of new cases. It's a lot lower than it was during the surge. No matter which way we look at it, that must be good news.
Yes, no, thank you. Good afternoon, Stephen. Yeah, it's correct that actually we're seeing a lot less number of cases compared to where we have been in the past months, which, as you correctly say, is actually great news. And in fact, we saw this even with the testing initially, in that the numbers that were being tested, though they did come down, and even the numbers that became positive, and this translated into the number of cases we're seeing. And it's not just the cases that we're seeing, we have also seen a significant decline in hospital admissions. So really, this is good news, and we can all now see that we are on the decline. But this also means we can't then be complacent, because if we're looking at the other countries, we have seen that you get this decline, probably another 30 to 60 days, lull, but then a possibility of a resurgence. So we don't want to just be complacent, but want to prepare in case we can get a resurgence. Thank you.
How many tests are you doing every day at the moment compared to how many you were doing during the surges? I mean, we saw in Gauteng, Eastern Cape, Western Cape. I mean, I presume you're doing fewer tests now.
Yes, I mean, in the month of the highest peak, which was around, early July, we were actually testing combined, the private and the public sector, about 45, 46, 48,000 tests per day. And if you're looking at where we are right now, I mean, just this morning, on yesterday, be it a weekend on Sunday, there were only just over 10,000 tests. So there has been a decline to between 10 and 20,000 within, the last few weeks. So there's a definite decline.
There are all sorts of conspiracy theories about this, Professor, that we're doing fewer tests because we want to report fewer cases. But am I right, we're actually doing fewer tests because fewer people have symptoms?
Yes, we're doing fewer tests because firstly, what did reduce the number of tests that were done, it was because we did actually improve, and we did change the strategy of testing, where we're testing according to priority, and therefore that did reduce the number of tests. But even just people who are coming in requesting tests, because we're seeing a significant high number of people who would actually present themselves for testing in the private sector. We don't see that anymore. So really, when we're talking about the reduced numbers, we're seeing a reduced number of those who are coming up for testing. Otherwise, everybody else who's coming up for testing is getting tested. And like I say, I mean, the priority for testing did change. And we're now looking to see, because now we have got the capacity to do more tests, we can actually increase, those communities that we should be, we want to be testing into the future.
We see sometimes in the past that there are fewer new cases being announced on a Sunday night into a Monday morning than during the middle of the week. Now, I like good news on a Monday morning as much as anybody, but is there a particular reason why that happens? Is it to do with just the number of tests being done over a weekend?
Yes, actually, and we've seen this since the beginning of the pandemic, that, I mean, you'll have these high numbers during the week, and then there's a dip over the weekend, and we continue to see that even now with the reduced number of tests that are being done.
Okay. And then, I mean, capacity. I mean, obviously you're doing fewer tests now, but it must have taken a huge amount of resources during the peak. If there are concerns about, another surge, let's hope it doesn't happen, but if it does, how are you feeling about capacity at the moment?
No, at the moment, we're actually very confident with the capacity, because with the surge that we have seen, firstly, we're able to assess at the beginning of the pandemic, we're able to assess the capacity that the country had, looking at both the private and the public sector. And once we're able to assess that, we're able to actually increase and improve the resources in that. If you're looking, for instance, at National Heath Laboratory Services, where I work, we were able to bring in a lot more of testing platforms, which we're able to utilize, and this definitely increased the number of tests that could be done. And the same thing happened in the private sector, where the platforms and the methodologies of testing, they were improved. So as we sit right now, we've what, we're all confident of the capacity that we have. And when we're looking at the numbers, we've looked at, in the private sector, they can do, comfortably about 25,000 tests, and in the NHLS, we're looking at another 28. So we really are looking at 50,000 tests per day, given, assuming that the reagents are available, which we've got enough of at the moment. So there's enough capacity in the country to spend.
And Professor Mlisana, I mean, I've learned more about epidemiology in the last 6 months than at any time. I've come to know more about epidemics than I knew about ESCOM before this as a journalist. One of the questions that no one seems to be able to answer, and we've asked several professors about this, is that in South Africa it seems that the percentage of people who have the disease, and then you look at the percentage of people who have very bad symptoms, so the percentage of people who have the disease who have to go to hospital is lower than in other countries. I mean, look at what happened in Italy, look at what's happening in the United States, South America, and yet here, even though, we have people who've had the disease, it doesn't seem to affect us as badly. Do you have any ideas as to why?
Actually, I suppose just like everybody else, we were not able to explain that, but I fully agree with you. We have seen that really when you're looking at the number of those who get to be sick, they have been definitely much lower than other countries. And it is the same thing actually that we're seeing, obviously, with deaths as well. Even when we account for what we've been calling the excess deaths, we're not seeing as the high numbers that we have seen in other countries. And we really we need to just try and understand this more and see whether we're able to explain this. But I agree with you that we definitely have got less, severe disease in the midst of everything else, that we have as a country.
Professor, I do need to ask you about workers at the NHLS. Now, how we did at one point lead a sort of, not quite a strike, but there was a bit of a demonstration and protests. Are your workers properly protected at the Health Laboratory Services at the moment? Are you confident those problems are being resolved?
Well, we have been actually, in negotiation, and and we've been, talking to Labour. And some of the issues that were raised were actually issues that when, we're able to sit down and, for instance, one of the major issues was availability of PPE. And when you actually sit down and analyze, it was clear that actually PPE had been available, and we have actually looked at making sure that then there's consistent and there's records of where there's need, and we make sure that we actually fulfill that need. So we have been, we're in negotiation with Labour, and it looks like so far things we're hoping, are going to settle down.